We are currently at Pantang in Accra, the Pantang Hospital, where there's currently a sit-down strike going on because health workers here have a number of concerns with regards to their safety. We'll go inside there and find out what it is their concerns are in detail, and also find out how operational the sit-down strike they're embarking on is. This is the Citi Newsroom. Please stay with us. So we are currently at the Reproductive and Child Health Services Family Planning OPD, and the first thing you notice when you get here is we are on sit-down strike. I see your sticker over here. What's happening?
Please, we are currently on a sit-down strike because of encroachers, and it's causing danger to everyone at the Pantang Hospital. That's why we are on sit-down strike.
So what originally happens here?
Okay, here is our triage area. Before you get in, we take your temperature and then we ask you a couple of questions before we allow you in.
So have you had to turn anybody away?
Today, yes please. We are only seeing to emergency cases, kids and pregnant women.
We'll go into the OPD and find out what's actually happened there. So please tell me, is this a normal site? No patients here?
No, really. On a normal working day, you see the bench here is for the A and C side. It would have been full with all pregnant women. Then the normal OPD would have been full with babies, mothers, and other patients who are not feeling well. But today, you see it's as it is.
So what happens to all the patients who would have originally come today?
They are to access healthcare elsewhere.
We'll try and see if we can get other workers to speak to, and possibly if we can get some patients who have been turned away while coming to seek healthcare. But I have with me another health officer here. What are the details of your concern?
The hospital is not safe for health workers and patients anymore. The reason being that land guards are engaged in gunfire battles with, two factions who are actually litigating on land supposed to be for the hospital. And this could endanger, it's a potential danger for staff of the hospital. Just last Saturday, there was a gunfire. We have the pellets around and we have made complaints to the police. It didn't start today. We've been at this issue of land encroachment by private developers on hospital lands about 3 years ago. We've made all the noise that we can. The Ministry of Health is aware. The other time, 3 years ago, when we actually withdrew our services, the Minister of Health, Honorable Kukwajima Menu, came around, spoke with us, and promised to bring this impasse to an end. Following from his visit, the Parliamentary Select Committees on Health, Lands and Natural Resources also paid a visit. We took them on a tour and they unanimously agreed that this land space must be preserved for public good. At 3 years on, nothing has happened. Today, staff face attack from criminals. Nurses, doctors on their way to work or from work have been attacked at knife points. Their mobile phones taken away from them. Some of our female staff have risked being raped. Some barely escape. And there have been a lot of incidences of theft in the residential facilities for staff. We are saying that we want this place to be a safe place for us to work. Until then, if after 11 of June, 1 week after this, and we still don't have anything concrete from the duty bearers, we will totally withdraw our services. And so we are just following on our roadmap.
So you take us a tour around the facility and help us understand what really happens here on a normal day.
So on a normal day, this is a recovery room. Usually on a normal day, these beds will be occupied, and this is the recovery one, and these nurses will be very busy. You won't find them seated like you are seeing them right now. They will be very busy running, serving medications, attending to emergency cases. And you find our doctors here. Oh, this place is a busy place.
So let's have a look at the other places.
So the sit-down strike is in full force. It's going to continue until about the 18th, when, depending on what happens, we might withdraw our services. We don't want to get there. We want to see the wall being erected We want to see efforts at, getting, the buildings that have encroached on our lands off our lands.
So let's go see the other facilities too. All right, Doc, so your signpost here says Psychiatric OPD, 24-hour service. What happens in there?
So this is the Psychiatric OPD. That's the first point of contact for anybody coming for mental health services. So what happens is that you come here and then you have doctors and nurses and personnel trained in mental health to actually consult, diagnose your problem and make decisions as to whether we are treating you on outpatient basis or we have to admit you.
So that's the facility over
That's
there.
the facility there.
Okay, so as we speak now, what's happening there?
Yes, like I was saying to you, last Saturday, there was a gunshot. Okay, and the land behind them, begins the area acquired for the National Orthopedic Center, which now is said to be someone else's property. And by logical extension, it means that this very structure is on someone else's land. And so with the litigation as close as.
And you mentioned that there are some of your colleagues who live on the premises.
Yes. So some of the structures along house staff who are living there. They are using us for residential purposes. And so you can imagine you've closed from work and then you hear gunshots. And then some of them have been victims of theft. Okay, at gunpoint, at knife points. And it's becoming unsafe for us.
So we are now at the entrance and I see some of your colleagues busy pasting notices there.
So we're just notifying the public that we are on a sit-down strike and they can't have access to services. It's bad. It's sad that we have to come to this point. And we were hoping that we wouldn't get here.
From behind the camera also, you can see right there is visitor being turned away, and from what you can see over there, those are officials of the facility engaging them and making them understand that they are on a sit-down strike. So no patient will be attended to today unless it's an emergency. I'll try and get closer and see if I can speak to any of them.
Dansoma. Mebano Yalihano okokrom no tutubu okita sikan obewo obi sikan nkrofo chinu anka ye be krum nukla nti mi pacho na mu hwe ma mi wai pacho wai owoka no ya wanu panie wa ni ho aju kakla odaka no.
Na intisia yesi omunye djume obene dai mami
no na mi pacho wudi no kwa mi ni mudi obesi
na pacho woni hwan na nti anka bibini a obetimi aboa
mi ni obi anti ni papa ewu.
A rather emotional encounter there. That's a woman who is stranded and not sure what to do about her child who is having some psychiatric concerns. Let's try and get closer to the patients who have also been turned away and hopefully get their attention and find out what they plan on doing. Where have you come from?
I come from Edukrom.
Edukrom.
Yeah.
So what did the health officials tell you precisely?
Yeah, they'll tell me that they are in Israq about the land issues.
So now that you've come all the way from Edukrom and you can't your relative can't be attended to, what are you going to do?
We don't know what we are going to do now. It's like we guess we don't know because our journey and then the time also I don't know. We don't know.
But how serious is the case you are bringing to the hospital?
Yeah, Miss Rose said because then I want to know feature and one did up to by this time. So anything can happen.
So you heard it there from one of the a person was bringing a patient in and he has to be turned away. He has to drive all the way back, and that's over an hour's drive to get to Pantang. But the notice says it clear here. Staff are on sit-down strike and they are attending to only emergency patients, emergency cases. So if you're not an emergency today at the Pantang Hospital, you wouldn't be attended to. Let's go inside and see what more we can find. So we are the OPD of the psychiatric wing of the hospital, and as you can see, there's literally nothing happening here. I'm sure you can see at the far end a couple of nurses gathered together, probably while in our wait time. But then, so we'll take a tour of the other facility, the other parts of the facility, and try and see firsthand some of the parts of the facility that have been encroached on, and see how it directly impacts on activities on the facility. Please stay with us. Doc, so which parts of the facility are we now, and what's happening down there?
So this portion is behind the Psychiatric OPD. Then we have the Health Assistant Training School over here. And this is part of the land under contention. You can see them working over there. They work day and night, putting up all these structures. A lot of attention has been lifted off this place because of the COVID. They've taken advantage of that to do all this work. There's a lot of sun raining going on over there. I would have loved us to go there, but without security, it's not safe to go there. Anything can happen to any one of us. These people are protected by land guards as they build over there, and you don't want to go close to them. They know we are not happy with it, and they are doing so many things to scare us and to get us away from all that is happening. So that is the situation we find ourselves in now.
You already sound scared.
It's scary. You should be here and hear a bullet at night, then you know what it feels like. You don't want to find yourself in any of these situations. You can't really trust any of those people.
We are now at one of the facilities where that houses a number of the health workers here at Pantang. As you can see, there are a number of children running around playing on the facility. Can you imagine what it felt like for these kids to hear gunshots that fateful evening? We'll try and get in touch with some older folks who live here and find out their experience or what they remember from that night. For you, as someone who lives here, what do you think of that?
At least it's really scary, and then it doesn't also place us at a safe grounds as residents here to us. For at least with the issue of our language there, it doesn't sound well at all. It doesn't sound well at all.
Now we are at the mortuary area of the hospital, and to my right you can see a structure currently under construction, and as you can see, it's a number of stories high. Now, Doc, tell me, for you as a health person, how much of a concern is having buildings sited this close to a mortuary?
So this raises a lot of public health concerns. To have such a structure close to a mortuary, putting aside the fact that it's fronting the hospital, limiting access to the hospital and all that, just in case of, like, we are facing a pandemic right now, what happens? We keep dead bodies here. How readily can these infections move from here to over there? Such buildings shouldn't be that close to a mortuary. It's just not right so far as public health implications are concerned.
Now let's talk to Mr. Wuku, who manages the facility. How is all of this activity hampering work here at the mortuary for you?
We know that this is the hospital premises. So I'm in charge of the mortuary over here. And secondly, too, when they came, they know that they are start working on this land. And I questioned them, and they say, oh, the land is for them. So they sold the land to the people to come and work on it. So in fact, when you see, it is very bad that government land, people will encroach the government land, whereby this is the mortuary, and they sell the land like that.
So I see you've parked your hearses over there.
When they came, what they said is, from this side to this under this tree, is the place where they live for us. But from the place going like this, they have sold all the places.
You mean where the hearses are parked right now?
They sold all the places. You see?
So what happens to your hearses? Where will you park them? Because I see your premises too isn't that big.
That's the challenge we are saying now. That when they start doing that, they start the project over here, then the ambulance, where are they going to park?
So apart from your car park area that has been sold, which other part of this stretch has been sold out?
No, from this tree down to where the lorry park is and been sold. So there is no place now. When they start working now, then the ambulance cannot get a place to park again.
So we've been through the entire facility. Workers are not happy with the situation. They are concerned for their safety as well as residents of the area. Now, as you can even see, the mortuary too hasn't been left out from the impact. And we're hoping that the authorities will come and address the concerns swiftly, as patients will continue to be turned away until these concerns are addressed. Reporting for Citi News, my name is Michael Obodu.